Good evening, everybody. I'm Sayukta from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. You all know proper skin protection is the best thing you can do for the health of your skin today and slow down the effects of aging tomorrow. In today's era, changing weather with excessive heat or humidity increases risk of damage due to UV rays, which make skin more prone to wrinkles, melasma, and even skin cancer. We know that sunscreen is valuable from a skin cancer or sun damage perspective, as well as something that helps prevent fine lines and wrinkles. But according to a survey, 67% of people in India are not using sunscreen as daily skincare routine. Several things about sunscreen that we people are not aware of and that make us not to include it in our integral part of our skincare routine. So to keep you informed today, we are here to know about sunscreen in our daily skincare routine. So let's connect today with our skin expert, Dr. Divya Vijayaragavan from Chennai to know more about sunscreen and skincare regimen. Dr. Divya has completed PG Dermatology from Madras Medical College, Chennai. She has done fellowship in Cosmetology, Dermatosurgery, and hair transplantation. She has multiple presentations and noteworthy publications on her name. Being cosmetology and dermatosurgery are her core area of interest and expertise of Dr. Divya. I'm sure today's session on sunscreen is going to be very enriching for the viewers. So let's begin this session. A very warm welcome to you, Doctor, and I'm hoping that you are having a good day.
Yeah. Good evening, one and all. Have a great day for everyone.
Thank you. Yeah. Thank you, Dr. Divya. We are really looking forward for this session. And as today we are going to cover a very important topic, which is sunscreen as a skincare routine. Now, the very first thing that comes in our mind when we think of sunscreen is, okay, fine, sunscreen is there, but I'm not going out much under the sun. So why should I wear sunscreen every day? Please shed some light over this, Doctor.
It's a very beautiful question, because in this era of modern technology, we are living almost with gadgets in everywhere. It's like when you move around in your house also, you see gadgets everywhere. Also, when you move around in your vehicle also, you get little bit of sun exposure, not directly. So I would say, like, when you're using a sunscreen, it's not just that when you go out, you have to use a sunscreen. You also have to get yourself protected from infrared rays and other visible light, what you get from your gadgets more. So use of sunscreen has become a very, very innate and very routine procedure nowadays.
Right. So it's very important, essential to use sunscreen every day, no matter whether you go out or you are exposed to sun or not. Anyways, the harmful rays are affecting us from the sun or emitted through other gadgets, light sources, etc. Now, doctor, whenever we go to buy a sunscreen for us, there are so many things that we are not still aware of. First thing is SPF. Now, we would like to understand what is SPF and why we should know about it while choosing a sunscreen for us.
All right. When you are choosing a sunscreen, first we have to know about SPF, which is sun protection factor. It's like when you buy a food or something, you have to know about the quality of that particular thing. So SPF gives you a clue about the quality of the sunscreen and the spectrum of protection what you're going to get from the sun. Okay, so if I say SPF, it will approximately give you a value of the percentage of protection what you get from the exposed light. Okay, say UV radiation, the sun from the sunlight will tend to burn or tan your skin, or on a long-term basis can even cause melanoma or kind of photoaging or even skin cancers. So to protect from them, we are using a sunscreen. So in order to use a sunscreen, you have to know how much protection you are getting from it. So that is decided by the SPF, and it is not the only deciding factor. Sun protection factor is like See, a percentage of when you're getting exposed to, say, for example, if you're getting exposed to sun for 10 minutes, so how much time it takes for your skin to get burnt? Say, example, 10 minutes. So when you are wearing a sunscreen, how much time it will take for you to get burnt with the sunscreen applied? It may be 50 minutes or 60 minutes. That kind of a protection, what you're getting is the ratio between when you apply a sunscreen and when you don't apply a sunscreen. That doesn't mean that when you apply a sunscreen and go out in sun, you don't get burnt at all or tanned at all. It will give you a protection for, like, say, some 70 to 80% like that. So in our climatic conditions, a minimum SPF is 30 or 30 plus is required. So a lower SPF, say SPF 15, which is very commonly available, will give you a protection of almost 95 to 96% protection. So nowadays, we get umpty number of products with higher SPF, like SPF 50, SPF 80, even SPF 100. So that doesn't mean you get 100% protection. It means the higher the percentage, higher the protection. But it will not be a bigger change when you go upside of the sun SPF factor. Say if you get 30%, you will 15%, you'll get 95% protection. With 30 plus, you will get 97% protection. With SPF 50, you'll get 98%. So the higher the SPF, the change will be a little bit. But the selection of the sunscreen, the application, the amount you apply, along with that, other measures of sun protection will help you to get rid of these sun damaging rays.
Okay, so now at least we are clear about the fundamental behind SPF and how to choose the right SPF while buying a sunscreen. As you said, there are other factors as well, like how to apply it, how much to apply, how and when to reapply. We would like you to tell all these things in more detail.
Yeah, got it.
How much to apply, how to apply.
Very commonly asked question from any patient who is seeking a sun protection, particularly when someone is having some kind of hyperpigmentary disorders. When they are prescribed a sunscreen, they have all myths about sunscreen, which has to be cleared off. See, when you are using a sunscreen, say for example with the SPF 50 or SPF 30 or 30 plus, you have to use it when you step out of the house. It definitely depends upon the particular individual but in general, you have to apply 20 to 30 minutes before going out in sun or before you are getting exposed. So if I apply a sunscreen and immediately go out, I'm not going to get a full protection, whatever is like there. So 20 to 30 minutes, it will take that time to react with your skin and give you a protective layer that will reflect the UV rays. So at least 20 to 30 minutes prior to getting exposed. Another is, if I am going to go out today and I am going to stay out in sun for more than 2 hours or day long, I have to reapply the sunscreen every 2 hours. That is ideal. Okay, and the quantity of application is very much important, because whatever we convince it, we usually tend to apply very little, like a foundation cream or some kind of makeup creams or like that. So a sunscreen has to be applied liberally, in the sense, like if I have to apply a sunscreen lotion for the sun exposed areas on my body, I would need almost 6 to 7 teaspoonfuls of lotion. So imagine that quantity. So that much amount has to be applied to get a good protection. If we are applying like very little quantities, just like a thin layer, as it is, we are applying some serum or something, we are not going to get that much of SPF, whatever is mentioned. So you need to apply it very liberally. Another important thing is choosing the sunscreen. We have chemical and physical sunscreen that will act accordingly, but we have umpty number of formulations And in combinations are available, like combination of physical and chemical sunscreens are available. And we have to choose the sunscreen according to our skin needs.
Right. So these factors do play a very important role in protecting our skin from the harmful rays emitted by sun or the other gadgets or other sources of lights. Now, the thing is, doctor, you said it's very important to apply the right amount, the right kind of sunscreen. Reapplication is equally important, and you need to apply it well in advance before you are going to expose yourself under the sun. Now, my question is, many a times people are working from their homes. Nowadays is the new normal. Then there are people who hardly go out, and they feel that as they are not going out, they don't need to apply sunscreen. But as initially you said, it's very important, irrespective whether you are going out or not, that sunscreen you need to use regularly. Now, how to tell those people who are working from their homes, etc., that you also need to apply sunscreen on your skin?
Uh, we have to explain to them about the emission of infrared rays that you get from your TV monitors, computer or desktop monitors, or even from your gadgets. Some lamps we use from within our homes also emit infrared rays. So these infrared rays also have kind of photoaging effect on your skin. It's not only ultraviolet radiation emitted from the sunlight, also visible light and infrared rays have very much bigger impact, but it takes a very long time. Say, if I go out in sun without a sunscreen or any protection factor and stand in sun for some 20 to 30 minutes, I may get tanned or little bit of sunburn may occur. Okay, that I will see as an immediate effect. I'll get some kind of irritation, redness, or itching, burning sensation. Sometimes skin peeling can happen. These are all immediate effects, but some effects you can't see immediately. So it will be like what we call it as photo aging. You will see gradually your skin will lose its elasticity. You may find wrinkles and loss of elasticity, some kind of dryness. Those things will tend to appear pretty early than your chronological age. So when earlier people tend to get aging around 50 to 50 plus years, but nowadays you see photo aging appearing even around 30 years time. So those factors have to be explained to them. Also, particularly in case of females, homemakers, we have to explain to them about effects of sun exposure even for a lesser kind of time. Say, if I ask some homemaker to apply a sunscreen when they are going out, they take it as consideration whenever they are going out for an hour or so. So going out to the terrace or just going to a few minutes of walk outside or going to a market, they don't consider it as an exposure because they think it is just a few minutes. So those things also come under consideration. Also, sometimes most of the adolescent people and young adults tend to take medications for acne or some pigmentary disorders. These medications always have to be supplemented with a sunscreen to protect your skin from the sensitivity what you get from the medications, also to hold on or to maintain the effect what you get from the treatment.
Okay, so again, the bottom line is that sunscreen is very essential. You need to apply it regularly. Again, reapplication is important. The amount of sunscreen you are applying is important. But the thing is, doctor, that despite all this, 67% of people in India are still not using sunscreen. Now, there are many people who say that, their skin feels very dull or patchy when they use sunscreen, or they sweat a lot when they use sunscreen, or they see a white cast, which is not a very good feel as per the appearance is concerned. So they will complain so many things and say that that's the reason I don't use sunscreen. So how to counter these complaints that people often make?
That's right. Actually, when we were discussing about the types of sunscreen, we were discussing about physical sunscreen. So chemical sunscreen is a sunscreen that will react with your skin and form a protective layer to reflect the sun rays. Whereas physical sunscreen, it will not react with your skin. It will just form a layer that is inert to your skin that will reflect the um, uh, UV rays.
Okay.
In those cases, uh, when you when you're looking for an ideal sunscreen, what from a person's or a patient's aspect, like if I'm a consumer aspect, an ideal sunscreen should be it should be a broad spectrum sunscreen, like it should protect from UVA rays, B rays, visible light, infrared rays. It should be easy to apply, should not make you feel messy or oily. It should not be comedogenic. It should not leave you a whitish patch so that you don't look awkward, and it should give you a long-term protection. But when you get some effect, you don't get the other comfort. An ideal physical sunscreen is zinc oxide, which will give you which will not react to your skin, and it will give you a broad spectrum protection. But the thing is, when you are using zinc oxide in a purest form, it is very difficult to apply, and it will give you a whitish patch on your skin. But these days, because of lot of advanced technologies, micronized formulations are available. You get sunscreens, physical sunscreens which contain zinc oxide, but you don't get a whitish patch. You have silicone or silicone based matte finish sunscreens, non-comedogenic sunscreens. These are all available, and certain components in the sunscreen are not stable. So when they get exposed, they break down, and your protection becomes a very damaging factor there. In those cases, certain other ingredients are added to adjust with the ease of application. So in those cases, nowadays we have a lot of advanced technologies where you are not always getting those whitish patches. Also, according to the skin type, like be it acne prone skin, oily skin, combination skin, dry skin, sunscreens are available in all formulations, lotions, all those. So those who doesn't want to have those whitish hue after application of sunscreens can prefer chemical sunscreens. Those are available in transparent gel forms, lotion forms, even spray forms. So those days you did not have so many options, but nowadays we do have better formulations available. So they have to be given those options and can be selected accordingly.
Right. And as you said, there are so many formulations available these days, like spray, cream, lotion based, gel based. And you just need to choose the right kind of sunscreen as per your skin type and the conditions you are in, most probably the working condition. I mean, what your working condition, as per that, you can choose the best sunscreen for yourself. Now, talking about skin type, as you said, there are sprays, creams, gels, lotion. Can you please tell us how to choose a particular kind of sunscreen if I have oily skin or people who have dry skin or normal skin, which will go well with those skin types?
All right. First, I will say, if my job is like staying out in sun all day. It's like, say, an engineer, civil engineer working in a construction site. He has to apply sunscreen for almost all exposed areas. So when you need a larger area sunscreen, you may prefer to use lotion formulations. Okay. And for body surface area, though it's not comfortable to use a spray formulation in a face, spray formulation can be used over your uh, body surface areas like limbs, other body parts. That will be easy to apply, and reapplication is also easy. When you're going out in beach or some seashore or mountain, spray can be used, and reapplication is also easily can be used.
Right.
But if I have a dry skin, I can use, say, creamy lotion form or lotion form. If I'm having a acne prone skin, I am having pimples, I'm taking treatment for pimples, and I have an oily skin, gel formulations work better. So the absorption is also better. The greasiness is also lesser with those formulations. So if I have a combination skin, I would rather say go for a creamy formulation.
Mm-hmm. So now we know at least, which will suit our skin type. So we can just go and buy the best one accordingly, or else we can go and consult our dermatologist. The dermatologist will definitely help us in choosing the right kind of sunscreen as per our skin type and as per our work conditions. Now, the thing is, doctor, whenever we go buy a sunscreen for us, on the box, a lot number of information is there, like PA++, or broad spectrum, or protection from UVA, UVB, other infrared, blue light, etc., etc., water resistant, and so on and so forth. Now, my question is, what to look for, because there's so much on the box to look forward to. What are the most essential things that we need to check when we go buy a sunscreen for us?
All right. So when since you said about water resistant sunscreen, I'll tell you all water resistant sunscreens are not completely water resistant. Say those are specifically used during swimming and while you are in water sports. So even in those cases, if you are applying a water resistant sunscreen and go for swimming, after coming out of swimming or your water sports, wash off and again reapply to get good protection. Because since you think it is water resistant, it's not always water resistant. Once you sweat profusely, or once you wipe off, or after you go in water, you have to wash and wipe off and reapply, because it will not stay so.
Okay.
Okay.
Yes.
And in case of an acne prone skin, I would say don't go for water resistant sunscreens, because you think you're having an oily skin, or you are going to get sweat a lot. So in those cases, water resistant sunscreens will not help you much. So in those cases, you have to generally apply lotion or gel formulations. So in general, what all you have to look when you are buying a sunscreen. Okay, look for sun protection factor, SPF, which is mentioned like 30 plus, 50 plus in those numbers, and PA factor. It is like PA factor gives you protection against UVA. Like four-star rating will be better, or 5-star rating will be there. Lesser than 3-star rating will not give you a broad protection. Also, some sunscreens will mention protection against IR rays. Yes, infrared rays will give you an additional protection when you have when you are like before gadgets are getting exposed to light emission from lamps. Okay, these three things you have to look for. Also, acne, in case of people with acne, look for non-comedogenic formulation. It means non-comedogenic is it will not block your pores much, and it will not aggravate your acne. So the particles in the sunscreen will be of micronized formulation, so that will not block your pores and worsen your acne.
But many a times the acne prone skin people who have acne prone skin say that they are really, not interested in applying sunscreen because they feel that it will worsen the condition. Now, what's the truth? Whether they should go for a sunscreen or not?
Exactly, they have to go for sunscreen, because this is where this non-comedogenic formulation helps you. So a formulation which is very thick, which forms a thicker layer and a greasy layer, may block your pores and worsen your acne. In those cases, non-comedogenic formulations and gel formulations help you better, not in worsening the acne. Another thing is using a sunscreen is must for acne, because most of acne treatment regimens will contain retinoids. Retinoids works really well for acne, but retinoids also make your skin sensitive. A little bit dryness will be there, because it has to reduce sebum secretion. So in those cases, photosensitivity of that particular skin will generally increase. So it always has to be supplemented with a moisturizing sunscreen, or a sunscreen that will help you to prevent the sensitivity. So definitely an acne prone person during his treatment period have to use a sunscreen to get better results.
Right. So if you have an acne prone skin, please do not avoid or skip your sunscreen. Sunscreen is very essential for you. I'll pick few questions which our viewers are asking. So Namita Baghel is asking, I have a very busy lifestyle, 11 hours working in front of laptop. It causes dullness and darkness in my skin. Even she is also using lots of screen during nights as well. What she should do, doctor?
Okay. Since she's before monitors most of the time,
Yes.
sunscreen with infrared ray protection factor is important for her. So she has to check, you have to check for a sunscreen which mentions IR, infrared ray protection. Another thing is like cleansing has to be, depending on the skin type, if she has a dry skin, cleansing has to be very mild. Also, she has mentioned that some kind of night cream she's using. What type of cream or serum she's using need to be mentioned. If it is a skin lightening cream, definitely supplement it with a sunscreen. Otherwise, cleansing, toning, and moisturizing is enough to maintain a good skincare routine.
Yeah, we would like you to throw really, explain a little more on the skincare routine. What are the absolute basics that we can do for a healthy skin, doctor?
All right. I usually tell the CTM regimen, which is C, cleansing, T is toning, and M is moisturizing. Cleansing has to be mild, minimum 2 to 3 times a day, and use a cleanser according to your skin tone and according to your skin type. An acne prone skin, you can have little bit of glycolic acid, keratolytics like salicylic acid and retinoids added in this. In dry skin, it has to be really mild. Don't use an exfoliating face wash or a cleanser in case of a dry skin. In combination skin, you can use like a combination of these, but that after face wash, you should not feel dryness or roughness. So that's more important. That's about cleansing. And too much of cleansing is also not advisable. Some people, they feel that I have an oily skin, so if I wash off more, I may get a better cleansing, which is actually wrong perception. So if I wash more than 5 times a day, my skin gets dried up. So the skin will actually tend to compensatorily secrete more sebum. So in those cases, you are worsening the acne. Also during treatment period, the excessive cleansing will worsen the side effect part. So that has to be taken. But in most of the cases, in like acne or dry skin or even combination skin type also, go for a milder cleansing. While using a soap or face soap in particular, people tend to apply the soap directly on their skin and rub. That is definitely not at all advised. Take the soap or face wash, make a lather, then apply it on your face. Just like do a little bit of massage and wash, splash water and massage. Don't rub too much. That's also important. So after cleansing, just pat dry and not to rub. That's one thing with cleansing. Another thing is toning. Use a good toner, mild toner after cleansing, and moisturizer is needed, particularly in dry skin people. Other people can be supplemented with after cleansing moisturizer is supplemented, particularly during night times. That will help you to maintain your tone as well as maintain the elasticity. You will feel like soft and supple after using moisturizer. So CTM is like everybody has to follow. According to exposure, yes, you can add up sunscreen.
Right. And you have explained it so well. I'm sure our viewers are going to get benefited with that. I'll pick few more questions, Doctor. Palak Dubey is asking a very common conception or notion that people have in their head. Her question is, if I wear sunscreen often, can I get a vitamin D deficiency?
Very beautiful question. Very, very commonly asked question. Whenever we advise someone to use a sunscreen on a regular basis, The first question they ask is like, will I get a vitamin D deficiency? See, one thing is you use a sunscreen in order to avoid your photo damaging effects, photo aging effects like tanning and pigmentation. Okay. Second thing is, it's not just your facial skin or your all day exposure sun rays that will give you a better vitamin D production. So for any vitamin, you have to know the quantity what is required for your body. So in order to get the essential amount or quantity of vitamin D for your body daily requirement, you have to get exposed to the sun just 10 minutes. Like say, if I expose both my arms and forearms for just 10 minutes, your daily requirement is done. Also, the exposure of sun, which has very damaging effect, is between 9 a.m. and 4 p.m. So those hot sunny radiations are harmful ones. Otherwise, early morning sunscreen during sunrise and sun rays during sunset are the best for vitamin D production, and those are not harmful too. So just 10 minutes of exposure, what you get exposed to your legs or arms or your back is definitely enough for your daily requirement of vitamin D production. And also you have to protect other parts of your skin from exactly during this sunny time is very, very important.
Fair enough. So, Palak, you have your answer. I'm sure all the people used to worry whether, while wearing sunscreen, they'll miss out on vitamin D. No, you are not going to miss out on your vitamin D requirement. Please go have your vitamin D shots, but at the same time, apply sunscreen. That's really important. Priya Sharma is asking, what is the difference between UVA and UVB rays? Doctor.
All right. When you are seeing ultraviolet radiations from sun, UVA, UV, and UVC rays are there. UVC rays are completely blocked and absorbed by ozone layer. UVA and UVB rays are the ones that enter your skin. UVA rays are UVB rays are more damaging and it burns your skin. UVA rays causes some kind of tanning on your skin and aging signs like wrinkles and loss of elasticity. All those kind of dermatitis will happen with UVA rays. So also more damaging will be UVB, that we have various protection factors with that. So these are like spectrum of the radiations you get from ultraviolet rays.
Okay. Shruti Nigam is here asking, what is the best SPF to use?
For our climatic conditions, SPF, I would recommend SPF 30 plus is enough. If you get SPF 50, that is okay. Like more than 50, it is almost equal to what you get from SPF 50.
Okay. Sakshi Mehra is asking, what's the best way to handle sensitive skin?
All right. As I already mentioned, CTM, best way to mention, best way is to follow the CTM for your sensitive skin. Particularly use a cleansing lotion rather than soaps or keratolytic or exfoliative cleanser. So mild cleanser in the form of cleansing lotions or cleansing milk that will not give you foam or froth. Will give you a better cleansing, and it is like very mild cleansing. Another thing is moisturizing, that should always be accompanied for a sensitive skin. Also, try to avoid unnecessary products like applying so many serums and creams on your skin, and using makeups have to be avoided unless it is very, very necessary. So try to, it's like if you have to go on with a makeup, go apply, have a mild cleansing, apply a moisturizer, and then use your makeup on top of it. So when you're back from the event, definitely wash off the makeup and don't sleep with the makeup on, any type of makeup. So if you're like going out or it is outdoor, you have to use a makeup. Nowadays, there are a lot of available BB creams even, or foundation creams or sunscreen available in foundation formulation. So go for a makeup with a sunscreen.
Okay, fair enough. And Doctor, in India, we see a lot of people with hyperpigmentation or melasma, these kind of skin conditions. Can using sunscreen prevent us from having melasma or hyperpigmentation?
Definitely, yes.
Okay.
So see if you're having some hormonal imbalance, and it is like in the beginning period you see some signs of melasma, using a sunscreen will definitely stop the progress of that particular hyperpigmentary disorder. Specifically, blended genes and melasma kind of things. Also, during treatment, if you are using a skin lightening regimen or skin lightening cream or some medicine, the effect what you get, the clinical outcome what you get from that treatment is definitely protected with the sunscreen. So it stops the progress. It helps to maintain the results or clinical outcome what you get from the treatment. Also, in some inflammatory cases, say example acne. Acne is an inflammatory condition. So in those inflammatory conditions, using a sunscreen side by side will help you to prevent post-inflammatory hyperpigmentation happening. So a lot of inflammatory conditions, if you're using a sunscreen, you prevent inflammatory post-inflammatory hyperpigmentation from happening. So definitely it will help you in all the ways.
Okay. We have Suman Yadav with us, who's asking how to deal with dry skin that's peeling and is sunburned.
All right. If it is a sunburn, the peeling is because of sunburn. So go for a shorter. You have to consult a dermatologist to confirm it is a sunburn. Second thing, in the initial period, like when you have a sunburn acutely in those period, just applying a sunscreen may not be very helpful for you. So in that case, you have to use a treatment. For example, a mild topical steroid and an antihistamine will help you to get rid of that dermatitis condition. After that, once your skin is normal, then follow it up with a sunscreen. During the irritation period, like if I am having a burnt skin, I have certain irritation or peeling of skin. On top of it, if I apply a sunscreen, I'm not going to feel comfortable. It may actually worsen because it is going to cause you burning and itching or severe irritation. In those conditions, you have to treat the underlying inflammation, then follow it up with a sunscreen. If it is a dry skin, choose the formulation accordingly, or you can add on a moisturizer. After that, you can use a sunscreen.
Okay. And many people think, doctor, that sunscreen should be used only in summers or when the sun is visible. When the sun is not visible, it's rainy, it's cloudy. There's no need to use sunscreen. Is it right?
Definitely a myth. You have to use sunscreen all day throughout the year, particularly if it is cloudy or if you're going in a hill station or snowy areas or in a seashore where your need of a sunscreen becomes more than what you do in plains or during summer. Because during summer, you see a hot sun rays and then you use a sunscreen. When it is cloudy, the refraction of these UV rays are more and the damaging effects become more. So the need of sunscreen is definitely essential during these particular times. Also, when I'm going to a hill station or some kind of snowy places, you get exposed to sun. Also, some UV rays they come and get refracted from the snow parts, and then you get worsely exposed to the damaging rays in two ways. One that is getting refracted from the sun, and one you're getting directly from the UV rays. So specifically, if you're going out in a snowy place or hilly areas or cloudy areas, cloudy seasons, and seashores, when you're doing water sports, salt, particularly in salt seawater, the refraction will be badly causing damage to your skin. So definitely use sunscreen throughout the year, even if it is cloudy or even if you don't see sun directly, but you are getting the sunlight. So have it in mind and use sunscreen throughout the year.
Okay, doctor. And doctor, before we wind up this session, any take-home message for our viewers?
All right. So look for spectrum of sunscreen. Don't think that marketing's like 100 plus SPF and 1000+ SPF is not going to give you 100% protection. Always, like if you're a rider, if you're going in a two-wheelers, even if you apply a sunscreen, don't think you are protected 100%. So that's what we usually tell them. So particularly after skin lightening procedures or cosmetic procedures like lasers or chemical peels, your skin becomes a little more sensitive. That has to be protected with the sunscreen. But using a sunscreen alone is not 100% protective. That's the take home message. So when you're going out, try to cover, apart from applying sunscreen, try to cover up your face with a protective clothing, or use a hat or a helmet along with the sunscreen. That will protect you better, in a better way. And even if you use a long day long sunscreen, or if it is like cloudy, it's better to reapply if you stay out in sun for more than 2 hours. Okay. Right. And for nowadays, because of our environmental change, our lifestyle change, everything has changed. The earth is undergoing so many changes. In these days, protecting our skin becomes ultimate, very, very important part. So sunscreen should become your daily skincare routine. So I said CTM, cleansing, toning, moisturizer. It should be CTMS. It should be cleansing, toning, moisturizing, and sun protection. So that you get a better skin, you get to delay your aging.
Right. Thank you so very much, Dr. Divya. It was such an informative session, and I'm sure our viewers are going to really utilize this information for the best for them. Thank you so very much once again. We really look forward for many more such sessions for our viewers in coming times.
Yeah. Thank you so much. The questions are very good and very wise, smart questions, and you made it very easy and explained it very well. You are doing a good job. And thanks for the viewers for those smarter questions and patient listening.
It was a pleasure to have you, Doctor. Thank you so very much. And viewers, thank you for your active participation in today's session. And please stay connected to our beautiful Spotless Skin page. Thank you. Goodbye.
Thank you.